Hey, you guys, this is Dr. Dan Lieberman with BestPracticeHealth.tv. I'm here to talk to you about the best practice recommendations for the treatment of sacroiliac pain. Now, if the hardest thing about sacroiliac pain is often figuring out that that's what you have, and if that's your situation, this is not the video for you. Watch some of our prior stuff on the signs, symptoms, and diagnosis of this very perplexing disorder. This video is for people who know that that's what's wrong with them, and they're looking to know, well, what's the right treatment? Like all musculoskeletal disorders, when you have a new pain, the first thing you want to do is a red flag survey. We basically just want to make sure that you should maybe be taking care of yourself and not just watching this video if it's something that's really urgent. And those urgent things really fall into three categories there: recent trauma, tumors, or infections. All right, for the 99% or more of the rest of us who it's just sacroiliitis, sacroiliac pain, you're good to go on and do home care. Home care starts with rest. Be active, but not too active. You can use ice if that seems to help, but generally muscle relaxants are better with moist heat. So use moist heat to help things calm down. There are sacroiliac braces you can order on Amazon. Some people get a lot of relief from them. They may be worth giving it a try. And if you need medications, use NSAIDs, which are Aleve or ibuprofen, unless those are not safe for your body, in which case stick with Tylenol. Now, if you get to 3 weeks and the pain is still there, it's time to throw in the towel and call a doctor. And generally, primary care doctors can be either medical or chiropractic doctors. It just so happens, of all the things that chiropractic care is good for, the thing it's the best for is sacroiliac problems. So if you have a chiropractor, hit them up for this. Sacroiliac care is really their strong suit. They'll start out, like all chiropractic, with 5 treatments. At the end of those 5 treatments, they'll see if you're getting better. If you're not showing signs of progress, then they need to refer you to a pain management doctor. If they are showing signs of progress, get 5 more treatments and see if that takes care of it. Now, if you're in that unfortunate group that ends up seeing a pain management doctor, the pain management can do a sacroiliac injection. That's going to be a combination of a steroid along with a local numbing medicine. And you really get 2 benefits from that injection. The first is it's diagnostic. If the sacroiliac joint, not your low back, was the actual source of pain, then injection into the sacroiliac joint, not the low back, is likely to relieve it. So you find out for sure that that's your problem, and there's a lot of value in that. And then the second thing is it's therapeutic. It makes pain go away. So which is, all we ultimately care about anyway. Now, it's rare, but if you get out to 9 weeks and you're still having pain, you're someone who should consider radiofrequency ablation for your sacroiliac pain. That can be done by your pain management doctor. Radiofrequency ablation doesn't work very well for this. It works better for low back pain and even better for neck pain. So not very enthusiastic, but it's not invasive. It's not hard to have. It's not super painful, so it's worth a try, but it's also probably not going to work. If you get to 12 weeks and now you've flunked everything else, it's time to think about having surgery. There is a fusion procedure. Even though the SI joint doesn't move, fusing it often does relieve the pain. That's done by specialized neurosurgeons or orthopedic spine surgeons who do this procedure. This is a very treatable condition. One way or another, it may take shorter or longer. We're going to get rid of it. So hang in there. If you have any questions, just drop them in the comments below. As always, we answer every question on the channel. Thanks. Have a great day.